The effect of an upper body agonist-antagonist resistance training protocol on volume, load, and efficiency. School of Pathophysiology, Faculty of Health Sciences, University of Sydney, Lidcombe, New South Wales, Australia. And Memorial University of Newfoundland, St. John's, Newfoundland, Canada. Introduction. Resistance training is an effective method for developing muscular strength and has been associated with improved health and decreased risk of chronic disease and disability. One of the primary variables to be considered when designing resistance training programs is the volume of work prescribed. Volume of work may be described as volume load, VL, and be defined as a load multiplied by the number of repetitions performed with that load. It has been suggested that greater VL may lead to greater strength gains. Although prescribed VL may vary depending on the goal of the program and philosophy of the designer, the ability to perform the prescribed VL in less time may be beneficial to both athletes and the general population. A number of training schemes have been suggested to achieve greater VL in a time-efficient manner. One such training scheme aimed at increasing VL per unit of time, VL over time, commonly prescribed by practitioners under designations such as superset or compound set, couples agonist and antagonist exercises in an alternating manner and may be referred to as a paired set PS training. Among a variety of possible agonist-antagonist combinations in PS, which couples two heavy traditional weight training exercises, bench pull, bench press, volume load over time may be viewed as a measure of efficiency defined as work performed per unit of time. It may be increased by either decreasing time, the denominator, or increasing VL, the numerator. Peer-reviewed research investigating PS-type protocol in an acute setting is limited, and only 2 have examined the efficiency of PS-type protocols over repeated sets. The 2 multi-set investigations compared a PS-type protocol to a traditional protocol. Bench pull and bench press VL per set and session were similar under both protocols. The PS-type protocol were completed in approximately half the time required to complete the traditional protocol. Specifically, the PS-type protocols were completed in 10 minutes as compared to the traditional set TS-type protocols, which require 20 minutes to complete. That is, the denominator in the efficiency equation, VL over T, was reduced under the PS protocol, thereby allowing the researchers to conclude that the PS-type protocols enjoyed greater efficiency as compared to the traditional protocols. However, it is unclear if similar results, enhanced efficiency, would be obtained were the testing session completed in similar time periods. Enhanced efficiency under such circumstances could only be achieved if VL was greater under PS as compared to the TS. Knowing that time is a crucial factor in the retention of a good general population and fitness programs and training time for athletes, it is imperative to investigate the effect of similar 10-minute protocols. Rest intervals between sets of resistance exercise are necessary to allow the exercise muscles to resynthesize intramuscular phosphocreatine and adenosine triphosphate and to remove metabolites detrimental to work production. It has been suggested that a 3 to 5 minute rest interval between resistance training sets is adequate to recover and to perform a similar amount of work in successive sets, 6 to 8 under PS training, during the rest interval in which the initially exercised muscle group is recovering. The antagonist to the muscle group initially exercised musculature is targeted. Commonly, in a training session, sets of one exercise are completed before progressing to the next exercise. For the purpose of the current research, a TS protocol refers to the sets of one exercise, bench pull, being completed before the performing sets of another exercise, bench press, targeting the antagonist musculature. Assuming a similar time to complete training sessions when comparing PS to TS, it is possible that under PS, the initially targeted muscle group is better able to recover during the prolonged rest interval between like sets. This would also be the case for the musculature exercise in the second phase of the PS. Under PS, the exercises are performed in an alternating manner over consecutive sets, assuming that more complete recovery is possible over multiple sets. VL may be increased per unit of time by concurrently training 2 muscle groups in such a manner. That is, the numerator in the efficiency equation, VL over T, is increased, thereby resulting in enhanced efficiency. Commonly, Athletes in resistance training setting perform multiple sets of isotonic load remains unchanged exercises. To date, only 2 scientific studies have reported on the efficiency of PS in which the agonist-antagonist pairing of the isotonic exercises were investigated over consecutive sets, and they compared PS-type protocols to TS-type protocols, where the TS-type protocols were designed to require approximately twice the time to complete. Research investigating the PS in terms of efficiency, in which the time to complete testing protocols is similar, does not exist. To support the conclusion that PS training is efficient, research is necessary in which the time to complete protocols is held constant. It is possible that this method of training could be an efficient and efficacious method for developing strength. The purpose of this study was to investigate the efficacy as measured by VL over the efficiency VL over T of agonist-antagonist PS versus TS involved 2 heavy resistance exercises. It was hypothesized that PS training would provide both greater efficacy and efficiency as compared to TS. Methods. Experimental approach to the problem. A within-design, randomized counterbalance comparison was used to investigate whether significant differences in VL, load times number of repetitions, efficacy, and efficiency existed between the PS and the TS over 3 sets. Because of the familiarity with the movement and their widespread use as a means to develop strength, bench pull and bench press were chosen as the pulling and pushing exercises respectively. A 4 repetition maximum 4 RM load was prescribed for all sets in both protocols and was performed to failure, which was considered to have been reached when another repetition using the proper technique could not be performed. The completed number of proper repetitions was recorded for each set and used to calculate VL for each set of both exercises. High-intensity loads 4 RM performed over repeated trials have been recommended with respect to strength and development. The TS protocol was designed to reflect the common practice of stressing one muscle group via multiple sets before moving on to another muscle group. The PS protocol was designed to stress the same musculature as the stress under the TS condition, but in an alternating manner. The total time required to complete the testing session was similar. The TS protocol involved performing 3 sets of bench pull followed by 3 sets of bench press, with a 2-minute rest interval between each set, figure 1. The PS protocol performed the same exercises, bench pull and bench press, but with the rest interval between like exercise sets was twice 4 minutes, and that used in the TS protocol 2 minutes, and the rest interval between unlike exercises sets was 2 minutes. The second exercise set, bench press, was performed in such a manner that the midpoint of the execution of the second exercise was 2 minutes after the beginning of the execution of the first exercise set, figure 2. Subjects: 16 trained men with at least 1 year's training experience with pushing and pulling resistance exercises volunteered to participate in the study. Participants were generally collegiate athletes with several years of training experience, and testing occurred during the off-season, the months of April and May. The participants' descriptive data are displayed in Table 1. The study was approved by the University of Human Ethics Committee review. Before the investigation, all subjects were briefed on the testing protocol, experimental risks, equipment, and the nature of the study before signing an informed consent document. All participants were asked to refrain from any upper body training for the 48 hours before each training session. Procedures. Volume load was measured during all sets of both protocols by multiplying the load by the number of correct repetitions achieved. Participants underwent a familiarization session to determine their 4 RM for the bench pull and bench press, and were instructed on exercise technique. To determine 4 RM, participants performed a set of 5 through 10 repetitions using 30 to 50% of the expected maximum, followed by 1 minute later by a set of 3 to 5 repetitions using 50 to 70% of the expected maximum. After a 2-minute rest interval, 4 RM attempts were made with approximately 2-minute rest intervals between attempts. If an attempt was successful, using correct technique, further attempts were made using increasing increments of weight. The last successful attempt was recorded as the participant's 4 RM in that lift. This procedure was adopted from Stone and O'Brien, with one change. Rather than 1-minute rest intervals between attempts, 2-minute rest intervals were used. The familiarization session was performed 1 week before the first testing session. was performed 1 week before the first testing session, which was performed 1 week before the second testing session. All testing was performed at the same time of day, and a standardized warm-up specific to the testing protocol was performed in all 3 sessions. Before testing, participants performed progressive submaximal exercise. Specifically, participants performed 3 sets of lifts similar to the 2 lifts being tested at 60, 80, and 90% of 4RM calculated from the previously determined 4RM. A 4-minute rest interval was provided between like exercises before the TS testing session. The warm-up sets were executed in a successive manner, that is, 3 sets of the first exercise followed by 3 sets of the second exercise before the PS testing session. The warm-ups were performed in an alternating manner. All sets of both bench pull and bench press were performed to failure using previously determined 4RM loads. The bench pull test was performed on an adjustable high bench, Apex B45 adjustable flat bench positioned on step 1005 platforms. Participants were instructed to lie prone on the bench and grasp an Olympic bar placed on the floor with a pronated grip. The bench was adjusted so that participants' arms were straight in this position. A repetition was deemed to have been completed by moving the bar from the floor until it touched the bottom of the bench. Between repetitions, the bar was motionless on the floor for 1 to 2 seconds. Hand placement and tempo were self-determined. Participants were instructed to keep their head, upper body, and legs flat to the bench when performing the bench press. Participants lay supine on a flat bench with feet flat on the floor and head, shoulders, and buttocks flat to the bench. The repetitions A repetition was deemed to have been completed when the bar was moved from the chest to a position of full elbow extension. Between the repetitions, the bar was momentarily held motionless on the chest. Hand placement and tempo were self-determined. Before the commencement of the 3 testing sessions, a reliability study involving 10 of the subjects who later participated in the study determined the self-retest separated by 1 week, interclass correlation coefficients, ICCs, and percent total error, percent TE. Traditional set protocol. Before testing, participants performed the above described standardized warm-up. Testing commenced after a 4-minute rest interval. 3 sets of bench pull were followed by 3 sets of bench press with a 2-minute rest interval between each set. All sets were performed to failure using a previously determined 4RM load. The load and number of correct repetitions completed were recorded for each set of both exercises. All sets of bench press were spotted by an experienced lifter to ensure volitional fatigue was achieved safely and with the confidence of the subject. The testing session took approximately 10 minutes to complete. Participants were given verbal encouragement during lifts. During the rest interval between sets, participants engaged in passive rest and were given verbal encouragement. Paired set protocol. Before testing, participants performed a warm-up similar to that performed in the TS protocol, except that the submaximal exercise was performed in an alternating manner rather than successfully. Similar testing procedures to those used in the TS protocol were implemented. However, the 3 sets of bench pull were performed in an alternating manner with 3 sets of the bench press. Also, although the rest interval between like sets was 4 minutes, the rest intervals between work performed were less. At the midpoint of the rest interval between like sets, the other exercises, i.e. antagonistic, were executed. The rest interval between work performed was approximately 2 minutes. Therefore, the testing session was completed in approximately 10 minutes. Participants were given verbal encouragement during lifts. During the rest interval between sets, participants engaged in passive rest and were given verbal encouragement. Statistical analysis. The set and sessions total of VL for bench pull and bench press in both testing protocols were calculated. These data were analyzed using a 2-way analysis of variance, 2 times 3, with a repeated measure and paired t-test to determine whether there were significant main effects of interactions for the type of training, TS and PS, in the sets 1 through 3. Analysis of the data determined if any significant differences existed between the 2 testing protocols was performed to investigate the influence of PS on the maintenance of VL. Efficiency, VL over T, calculations were also made. Paired t-tests were used to compare the percentage changes in bench pull to those in bench press. The level of statistical significance was set at p is less than or equal to 0.05 for all tests. All statistical tests were completed using Statistica version 6, Tulsa, Oklahoma, USA. Effect size calculations were performed on measures of VL. The reliability study determined ICCs in the percent TE for set and sessions VL over 3 sets for bench pull range between 0.75, 4.2%, and 0.83, 9.5%. And the same for bench press range between 0.82, 6.4%, and 0.96, 13.7%. Paired sample t-tests revealed no significant p is less than 0.001 differences between the two testing occasions. Results. Independent analysis of the testing protocol found that both bench pull and bench press VL decreased significantly from set 1 to set 2 and from set 2 to set 3 under the PS and TS conditions, p is less than 0.05. The percent changes from set to set in bench pull and bench press are shown in Table 2. Bench pull and bench press VL were set significantly less under TS as compared to PS over all sets, with the exception of the first set, bench pull set 1. Furthermore, sessions totals for bench pull and bench press VL were significantly less under TS as compared with PS. Volume load data and effect size for bench pull and bench press are shown in Table 3. Paired set training was determined to be more efficient. Efficacy calculations are shown in Table 4. Under the PS condition, the percent decreases in bench pull press were significantly greater than those observed in bench pull from set 1 to set 2 on set 3. Under the TS condition, the percent decreases in bench press were significantly greater than those observed in bench pull from sets 1 and 2 and set 3. Discussion. The most important findings of this study were A. Significantly greater bench pull and bench press VL observed under the PS as compared with the TS protocol, suggesting greater efficiency under the PS protocol, and apparent cumulative effects of fatigue generated by antagonist work on agonist performance. Although PS-type protocols have been previously reported to enjoy enhanced efficiency, this was achieved by manipulating the time to complete testing sessions rather than observing significant increases in VL using similar timelines, as is the case in the current research. The significantly lower VL observed in the first set of bench press under TS as compared to PS would seem to suggest that antagonistic work may have cumulative fatiguing effect on subsequent agonist performance. To the best of the research knowledge, similar findings have not been previously reported. Previous multi-set investigations into PS-type training did not report differences in performance measured on the first set of the second exercise. Regardless of the level of performance, volume of work prescribed is a primary variable to be considered in the design of strength and conditioning programs. The ability to perform prescribed VL in reduced time with the benefit to athletes and the general population, it has been suggested that PS-type training protocols are time efficient, thereby allowing for greater training density. In the present study, bench pull and bench press VL were significantly less per set, and for the session under TS as compared to PS, efficiency calculations, see Table 4, determined PS training to have greater efficiency as compared to TS training. These findings would seem to support the hypothesis that with respect to PS training, efficiency is enhanced in both the bench pull and bench press exercises. The observed set-to-set significant reductions in VL in bench pull and bench press under the TS would seem to indicate that a 2-minute rest interval is inadequate with respect to maintaining VL. This is perhaps not surprising because investigations into TS-type training protocols have reported an inability to maintain VL using similar load, i.e. 4 RM, and a longer rest interval, i.e. 4 minutes, in both bench pull and bench press. A 4-minute rest interval between similar exercise sets under the PS protocol was also inadequate in terms of VL maintenance. This is also in agreement with the previously reported findings. It would appear that under either training design, implementation, or current research, the prescribed rest interval did not allow for a level of physiological recovery, e.g. resynthesis of intramuscular phosphocreatine and adenosine triphosphate, and the removal of detrimental metabolites, adequate to return to the body to a state in which a similar amount of work could be performed in subsequent sets. It has been suggested that the rest interval necessary to maintain VL is dependent on the magnitude of the load, and specifically that submaximal, i.e. less than 90% of 1 RM, loads performed to failure require longer rest intervals as compared to maximal, i.e. 1 RM loads. As the present study was constrained by a 4 RM load, it is possible a load greater intensity, i.e. 1 to 3 RM, may be allow for VL maintenance over the repeated sets using either of the prescribed rest intervals in the current study. Although bench pull and bench press VL decreased significantly from set to set under both conditions, the decrease observed under TS was significantly greater than those observed under PS. The significantly lower VL observed under the TS condition resulted from the inability to compete as many repetitions under the TS as compared to the PS conditions, figures 3 and 4. A significantly lower VL was observed in all but the first set, i.e. bench pull set 1 of the sessions under the TS as compared to PS. It was not expected that differences would be observed between the first sets of the session because they were performed in a similar non-fatigued state under both conditions. The data suggests that prolonged rest intervals between like sets enjoyed under the PS as compared to TS allowed for greater physiological or mental recovery or both, and resulted in attainment of greater VL, given a similar timeline. Manipulation of the order in which the exercises were performed under PS allowed for the targeted musculature to enjoy a longer rest interval. Results would seem to suggest that the effects of VL maintenance of alternating agonist and antagonist work is somewhat less detrimental than are the effects of performing multiple sets of one exercise before performing multiple sets of another. It was expected that greater VL would be observed in subsequent sets, i.e. second and third sets, of both exercises under PS as compared to TS. However, a significantly greater VL was also observed under PS as compared to TS in the first set of bench press. The data suggests that performing 3 sets of bench pull before performing a set of bench press with 2-minute rest intervals between each set is more fatiguing than performing 1 set of bench pull 2 minutes before performing a set of bench press. That is, there would appear to be some cumulative effects of general, i.e. not localized to the musculature predominantly involved in the movement, fatigue associated with antagonist work that is reflected in the subsequent agonist work. It would seem likely that this is somewhat dependent on the length of the rest interval between sets, and specifically that longer rest intervals would mitigate this observed effect. In previous research under the TS type protocol using a 4-minute rest interval between sets, cumulative effects of fatigue VL and electromyography EMG were not observed in the antagonist musculature after 3 sets of agonist work. Specifically, VL and EMG activity were similar in the initial set of bench press after 3 sets of bench pull, with a 4-minute rest interval between sets as compared to bench press VL and EMG activity after 1 set of bench pull performed 2 minutes before. It is possible that TS-type protocols implementing a 4-minute rest interval as compared to TS-type protocols implementing a 2 rest interval, allowing for more complete recovery of the antagonistic musculature. Although cumulative general fatigue is commonly experienced by participants during resistance training sessions, this phenomenon has not been well documented in the literature and deserves further attention. Although bench pull and bench press VL decreased from set to set under both conditions, it is interesting to note that the percentage decrease was greater in the bench press as compared to the bench pull under both PS and TS protocols. In comparing percentages changes in VL between sets of bench press and bench pull, 4 of the 6 comparisons, see Table 2, revealed that the decrease in bench press were significantly greater than those observed in bench pull. Specifically under the PS condition, the percent decreases in bench pull were significantly greater than those observed in bench pull from set 1 to sets 2 and 3, and under the TS condition, the percent decreases in bench press were significantly greater than those observed in bench pull from sets 1 and 2 to set 3. This can perhaps be explained by the fiber-type composition of the musculature predominantly evolved in the bench pull as compared to the bench press exercise. The percentage of type 1 fatigue resistance fibers in the musculature primarily involved in the bench pull is greater than that in the musculature primarily involved with the bench press exercise. It has been suggested that the musculature involved in pulling movements may be more fatigue resistant than that involved in pushing movements. It is possible that the musculature involved in the bench pull is more fatigue resistant than the musculature involved in the bench press, and may explain why the observed decreases are larger in the bench press than in the bench pull under both conditions. Because of the nature of PS training, coactivation of the concurrent activation of the agonist and antagonist muscles should be considered. Muscle activity is partially dependent on contractile history, and it is therefore possible, although perhaps unlikely, that the mechanisms associated with the coactivation played a role in attaining a greater VL observed under the PS protocol in the current research. It has been suggested that preloading may alter the braking phase of the triphasic pattern of the previously loaded musculature when acting as an antagonist during subsequent power exercises. Specifically, that the braking period of the antagonist is shortened, thereby allowing for a longer total burst. However, the triphasic pattern is associated with ballistic movement and is unlikely to have a factor in protocols that use 4RM loads. It is possible that fatigue associated with coactivation influences results. That is, activation of the musculature when acting in an antagonistic manner resulted in fatigue, which negatively influenced performance of the musculature when acting as an agonist. Resistance training sessions aimed at exercising multiple muscle groups commonly involved greater than 2 exercises and 6 sets. Furthermore, the maintenance of greater acute VL under PS as compared to TS does not necessarily yield equivalent or effective chronic development or strength. Outcomes in acute efficiency, VL over T, do not necessarily translate to similar outcomes in chronic adaptation. The PS training is an efficient training method as compared to TS training does not necessarily mean that PS training is efficient with respect to chronic adaptation. The acute efficiency is negatively affected by fatigue. However, it has been suggested that fatigue may in fact act as a stimulus for strength development. That is, a variable responsible for reducing acute efficiency may act to enhance chronic development. Longitudinal research investigated the effects of PS training is necessary to determine the efficacy and efficiency of PS training. Practical applications. Under designations such as supersets, compound sets, contrast sets, and others, PS-type training has been prescribed by practitioners for years. Incorporation of PS-type modalities into training programs is commonly performed as a time-saving measure. However, scientific research investigating PS-type protocols in turn of time efficiency is limited. The current data indicate that heavy resistance 4RM PS training allows a greater loading of the imposed on the musculature than that achieved with TS training, given similar timelines. It would appear that this performing agonist and antagonist work in an alternating manner as compared to performing all sets of agonist work before completing sets of antagonist exercises allows for greater recovery of subsequent greater loading. More complete physiological recovery will allow higher volumes of work to be performed. Practitioners working with time-constrained clients, athletes, or the general population may be well advised to incorporate PS-type training into prescribed programs. Data from the current study indicate that neither a 2-minute rest interval nor a 4-minute rest interval with antagonist work done during the rest interval is adequate with respect to maintaining VL over repeated sets. Programs incorporating 4RM loads with the intent of maintaining VL over multiple sets may choose to use longer rest intervals. Comment on rest intervals lengths adequate to maintain VL using loads similar to those used in the current study is beyond the scope of this research. Data from the current study also indicate that there may be cumulative effects in general fatigue, that is, practitioners should be aware of antagonist work may influence subsequent agonist work. If certain exercises and training sessions are considered to have greater importance, practitioners may wish to prescribe such exercises before performing antagonist work. Furthermore, when tracking performance measures, e.g. VL, over a training cycle, practitioners should be cognizant of the order in which the exercises have been performed in each session. Although it would appear that the musculature involved in pulling movements may be more fatigue-resistant than the musculature involved in pushing movements, if this is the case, practitioners may wish to account for this when prescribing pushing and pulling exercises. Predictions regarding the chronic effects of PS training would be speculative at this point. However, it is possible that the PS-type protocols are an effective and efficient method for developing strength. For athletes, less time spent developing strength should translate to more time developing other aspects of performance and theoretically result in performance enhancement. For the general populations, possibilities of results in less time should attract greater numbers of people to resistance training. Resistance training has been associated with improved health and decrease in risk of chronic disease and disability, and therefore increases in participation will likely have a positive effect in the health of the general population. Before prescribing PS training to certain groups within the general population, Practitioners may be well advised to examine other possible physiological responses, blood pressure, for example, to such training, given the possibility that PS training may be beneficial to both athletes and the general population. Longitudinal studies investigating the chronic effects of PS training are warranted. Acknowledgements. The authors would like to thank the University of Victoria, Canada, for the allowance of the laboratory space and equipment. The authors have no conflicts of interest that are directly relevant to the contents of this manuscript.